It's the most common form of diabetes, and millions of Americans have been diagnosed with it, and many more are unaware that they're even at high risk for getting it.
We are talking about type 2 diabetes, and here to talk about what type 2 diabetes is, how you get it, and what the risks are if not treated is nurse practitioner Susan Angel. Thank you for being
How
here.
are you today?
I'm doing okay. This actually touches very close to home for me because I lost my grandmother to symptoms of type 2 diabetes. What is it and how do we get it?
Well, as you said before, I mean, it is definitely the most common form of diabetes in the population. And diabetes is a chronic disease, and what it does is there's increased levels of sugar or glucose in the blood. And this happens because there's problems with the way our bodies produce and use insulin. So the insulin helps get the sugar into our cells so we can use them for energy, but when there's a problem with that process, it's just hanging out there causing problems. And so some of the people that are at risk for it are those that are overweight, who have poor diet, lack of exercise, and of course family history and genes definitely play a part in that.
So what are some of the risks if type 2 diabetes is not taken care of and not, treated properly?
Well, because it's such a chronic condition and it takes time to develop, I mean, there are numerous organ systems in the body that it can impact. I mean, you can have nerve damage, you can have eye damage, you can be at risk for chronic infections that can result in loss of limb. It also makes it difficult to manage your blood pressure or your cholesterol, and then, of course, if those things aren't handled, then you're at risk for stroke, cardiovascular disease, and just a conglomerate of nasty things.
Yeah,
So at CNS, do you guys have a current trial that can help with the symptoms of and work with this?
We do, and some people might not even know that they have diabetes, and so some of the things they might be looking out for is if they're excessively hungry, excessively thirsty, having to urinate a lot, fatigued, or just have some infections that aren't healing. And so what we're doing at our site is we're looking at a new medication, an oral medication for diabetes that can be used in conjunction with some of the other meds that the patients are taking to help stabilize their blood sugar.
So if someone isn't sure that they have diabetes and want to go get tested, can they do so at CNS?
Absolutely. What we do is we offer a free pre-screening process, and part of that is looking at their health history, eliciting some of these symptoms, and if we think that they're at risk, then that's certainly something we can take a look at.
So if somebody is at risk or this is something that you guys could accept them for, what is the cost to that patient?
Well, which is a good thing. We don't require insurance, and there's no cost to them. So if they actually get involved in the study and we see that they meet criteria, then they'll even be paid a little stipend to keep them, coming back and participating. It helps with gas and time.
And offset some of the expenses.
Yeah.
So how does someone, if they're watching now and they're thinking that they want to get involved, how do they do so?
They simply can give us a call or visit our website, and it's just a matter of setting up an appointment, and it takes about 30 to 45 minutes once they get into the office, and we can go through the whole process and get them on their way.
And are there any other studies that you guys currently have going on?
Absolutely. We're also enrolling in studies for hypertension, high blood pressure, low back pain, depression, bipolar disorder, irritable bowel syndrome, attention deficit hyperactivity disorder for adolescents, and sexual dysfunction related to antidepressant therapy.
Okay, well, there's a wealth of things to contact you guys about. Thank you so much,
you.
Susan. We appreciate you being here. We also want to thank CNS Healthcare, of course, for sponsoring this segment.
So find out if any of their trials are right for you. Call 904-281-5757 and make an appointment for a free 30-minute evaluation session, or you can also log on to their website, cnshealthcare.com. Remember, all of their services are free and no referral or insurance is needed.
Coming up.